Joining me right now, Dr. Jaime Show with Mindful Rehab. Doctor, good to see you again. We've had you on before. It's been a while since we've talked.
Yes, I know. I'm glad to be here.
Hey, you've got something called Seasonal Affective Disorder, or SAD.
Yes.
Now, I mean, this is a real thing, because when I first saw this, I go, oh, you got to be kidding me, until I started looking at the explanation. What is it? When does it occur? Et cetera, et cetera.
Okay, seasonal affective disorder is a depression that is linked to the change in the season. Although you can have an onset of seasonal affective disorder at any change of season, it is most common now, right as we are in the middle of fall to early onset of winter.
So does it occur because people are thinking of the leaves falling, or does it occur because all of a sudden, I know now getting up in the morning, I hate getting up when it's dark.
Yes,
This
yes.
is like, yikes.
It is, it's different, and we have a lot more dark, right? And especially with the time change coming up, it's gonna be darker even earlier than it already is. So the change in the season actually impacts our vitamin D, our melatonin, and our serotonin. Vitamin D, a deficiency in vitamin D, period, has been linked to depression. But now with the change in the season, it's also disrupting our melatonin, which is in charge of our sleep.
Right,
and
yeah.
it's also impacting our serotonin, which is impacting our mood.
Does this happen in Florida too? Because I'm thinking, because I always used to think in my mind, I had heard of this before,
Yes.
but I always thought it was because it's going to be winter, it's going to be cold and that kind of stuff. But we also have shorter days here as well.
We do, and it is. So we are getting darker earlier, even here in Florida. Some of the symptoms that you're going to see with seasonal affective disorder is going to be maybe you're more irritable, you're sleeping more, weight gain, and a lot of the symptoms of seasonal affective disorder are parallel to that of a major depressive disorder. So you might realize that you're having trouble focusing and concentrating. You're not interested in things you were once interested in.
Now, when I see these symptoms, I got to admit that I know people. I have things occasionally,
Yes.
but how do you know when it really is this SAD diagnosis, and not just change of season and generally political season?
Yeah.
We won't go there. Okay, yeah.
It's disrupting your day. It's
Okay.
impacting your day. You know, you're not getting out to doing the things that you once wanted to do. You are sleeping a lot more, or your sleep is definitely irregular. Maybe you're gaining weight, so it's impacting your lifestyle. However, there are treatment options for seasonal affective disorder, so we don't have to freak out. You know, of course, there's medication, there's coaches, there's therapists. But one thing that is really interesting about seasonal affective disorder is they have a treatment called phototherapy. Some people call it light therapy. And it is actually a light box that sits next to you that emits artificial light that mimics the sun, and it affects brain chemicals that control mood, which is the serotonin, and sleep, which is the melatonin. So this box can actually help with that.
Are doctors not unwilling, but because I don't want to use that word, but you know, as a doctor, you always hate to jump to a conclusion.
Yes.
And you don't want to jump to somebody having severe depression.
Right.
Because sometimes it can be a little bit of a self-fulfilling prophecy. So how do you talk to your doctor about this without the doctor think that you're maybe a little slipped, or that you're trying to get on some kind of medication?
Absolutely. Well, explain the exact symptoms. Maybe you do notice that you're okay all year, things are okay, but as fall is, we're entering the holiday season, which is important to note too.
Oh, there's got to be is there a tie into that or not?
You know, seasonal affective disorder is real, and if you do have the depressive symptoms, it's very important that you take them seriously and you do see a doctor and you do tell them the symptoms. But at the same time, you can, if you have the ability in your health to control any part of it, take that control up. So, for example, we talked about seasonal affective disorder, weight gain, irritable, etc. During the holiday, be careful with what you're eating. 90% of serotonin is made in your gut. Serotonin is a chemical that makes you happy. If you're eating processed foods, fast foods, you're eating everything around you at the holiday, that's going to impact your mood. So instead, maybe meal prep this holiday season. Don't eat everything around. Bring in veggie trays. Find better options for eating to help.
If you say serotonin is in your belly, I'm being funny now. So the fatter I get, the more serotonin I got, the happier I am. No, you know, again, but it's one thing to say this, and again, I'm thinking about weight gain.
Okay.
I mean, does weight gain generally happen in the fall anyway, a little bit for most people, or not?
A lot of people, you are going to see a little bit of increase. That's why it's important right before the holiday season. Make sure that you're getting into a habit and a routine. Maybe you're working out 2 or 3 times a week, or you're meal prepping like we talked about, increasing your water, staying away from alcohol. Get in the habit now, so that because we're starting to slip into that holiday season right now. Set a routine and a schedule now so that you you are in a habit when the holiday comes to not kind of blow it.
Are we diagnosing depression now more than we have in the past? Are we seeing more, or are there things now that we're just now identifying as literally being depression?
You know, I think that we have a lot more awareness of it, so that is a great thing, but we're also coming out with more tips and techniques than we ever have to help treat it. So yes, there's medication and therapists, but we talk about support groups, and we know the impact that exercise has. You know, it decreases stress, it boosts your mood, and that is part of depression. So watching what we eat and exercising plays a major role.
Now, looking at the percentage, it said it could affect as much as 26. I mean, that's 1 in every 4. I mean, that's pretty high.
It is, and it's more common. Seasonal affective disorder is more common in women than it is men. However, when men have seasonal affective disorder, their symptoms are actually worse than that of a woman's.
So when we say, again, that 1 in 4, again, I'm really, this is what surprised me. Celebrities have admitted they've had this. Bruce Springsteen said it in his book. Selena Gomez. I mean, that's pretty amazing to me.
Well, you know, and the change in the season, going back to the darkness, that anything that impacts directly the chemicals in your mind and body are going to impact your mood and your susceptibility to depression. People that or seasonal affective disorder, people that need to really be cognizant of seasonal affective disorder, you have more of a susceptibility to it if you have bipolar or a major depressive disorder already.
Now, there's a big outcry because people don't want to get people hooked on antidepressants.
Yes.
And I know that figuring out which antidepressant really works, I know as a regime, that can be a 6-month process before you figure that out.
It can, but leave that to your psychiatrist. If you're being honest about your symptoms, you're reporting everything, allow that. I understand people don't want to be on medication, and I'm a proponent for trying everything that you can.
Everything
but at the same time, depression, seasonal affective disorder, they are real, and you need to take them seriously. And if you need medication, it is not a bad thing.
So you're a member of the family, you notice some of these changes are taking place in your loved ones. How do you broach this subject without them thinking, oh boy, he thinks I'm crazy?
Well, first be supportive. First be very, very supportive of their situation. Let them know that you've noticed changes, they're important to you. And it's key, I can't say it enough, just be supportive. Your support will guide them to the treatment that they need.
And don't let the people think that it's being judgmental, because judgmentalism and depression automatically, that's a turnoff. I'm not going to talk to you, not going to speak to you.
Absolutely. Wow. Support versus judgment.
Yeah, Dr. Jaime Show, it's from Mindful Rehab. Thank you for joining us.
Thank you for having me.
Come back around Thanksgiving and Christmas when we talk about the 20 pounds we gained over Christmas and the depression that comes with that. Well, I won't get into that. Doctor, thank you so much.
Thank you for having me.